Warwick Hospital Emergency Department.
Do you have capacity in there?
This was yesterday, the day of the ambulance strike. Fewer patients were being brought in, yet still they were almost full. 95-year-old Monty Tubb had been here for just over 6 hours. He was a Category 2 patient. He'd had heart palpitations, so he had been transported by paramedics.
I have been seen by a large number of people. I'm due to be seen by a consultant now. It gives me an opportunity of saying that the treatment that I've received in this hospital now and previously, first class.
What does this mean for today? Is this busy?
So yes, so this is busy. So we're minus 85 today. So we're in 37 escalation beds at the moment. So
This is the room with the data, and it was only 8:30 in the morning and they were overstretched.
We can see we've got 2 out of 3 resus cubicles, so we have a resus cubicle available should we need it. We've got nothing currently in minors. We've got 19 out of 20 majors cubicles, so we know that we're under pressure in majors already, which is where the ambulances tend to come. And we've got 8 in our majors waiting room and our corridor.
I don't even know how you keep it flowing if it's like that. I feel exhausted for you. And it's, what, 8:25 in the morning? Nobody doubts the NHS is in crisis, a polycrisis across the service. Hospitals, yes, GPs, mental health, social care. The emergency department paints just one picture.
Coming into our infection control prevention, we have a high rise numbers of our respiratory viruses.
And it isn't pretty. 71 who've tested positive for flu, COVID and those respiratory viruses. Have you ever known it this bad?
Dad, I say every winter we keep saying this is the worst ever winter, so I suppose no is the answer because of this twin and triple demics that we're going through.
So it's bad.
It is bad. It is bad.
Figures from NHS England today indeed show that ambulance response times in December were the worst on record. And the proportion of patients seen within the 4-hour target in A&E fell to a record low of 65% last month. Warwick Hospital has a number of different initiatives for keeping patients out of hospital or getting them back out into the community as quickly as possible, and yet it is still incredibly busy. The hospital is full, and one person has just said to me, frankly, it's about managing a bad situation. Nearly 2 years ago we filmed here, 12 months into the pandemic, and we spoke to Avon ward manager Sarah Rawlings.
It's emotional, it really is. It's been a tough 12 months. Sorry.
I saw you 2 years ago.
2 years ago, yes.
So what's changed?
A lot's changed, but then a lot is still the same. So we are still COVID, but we are also this winter, the impact that has changed is we now have all the other respiratory viruses. So we're seeing a rise in flu A and RSV, and we have all those on the ward as well.
You know, there's been a lot of talk from the government about the NHS needing to be more productive. Could you be more productive?
I don't think we could. You know, my team, we don't stop, we're busy. We're constantly on the go. We are constantly full to capacity, having to use extra capacity where we can.
And here's the thing. This is a hospital awake to innovation, full of ideas for how to lessen the load. The medical day case unit was set up last July to avoid admissions.
So this patient has come direct from the GP into MDCU.
I've come here because I've recently had a catheter fitted and I've got a urinary issue that's going to require a prostate procedure.
And what would have happened normally? He would have gone into ED and possibly been admitted.
He wouldn't have been admitted, but he would have waited there for a very long time to be seen. He would have obviously not been priority to be seen in A&E, so he would have waited in a queue where there's more serious people that need to be seen.
On average, 13,000 patients a day in England are in a hospital bed despite being medically fit. It's about 20% of inpatients at this hospital.
Okay, you ready to go home?
But Michael Bradshaw is no longer a statistic.
Bye, Michael.
The fire brigade, Warwickshire Fire and Rescue to be specific, have set up a service to take patients home.
It relieves the NHS. We get patients home a bit quicker. We aim to be at the hospital within 1 hour of the request coming through. So it saves patients waiting aimlessly and it clears beds for new patients coming in.
And Dr. Helen Dillon shows us a service which trains patients or their relatives
Hello. This is Mr. Longstaff.
to administer intravenous antibiotics in their own home.
And this is Mrs. Longstaff, who's been delivering his antibiotics with our support and guidance.
Why is it better?
Because I've got the comfort of being in my own home, but a high level of treatment.
This sort of system, getting people home with treatment, definitely is a plus.
Putting together all the services, and there were more than we can show, this was hundreds of patients being kept out of hospital beds. And yet, for all the innovation, they were overstretched. And there was still tomorrow, with many more sicker, frailer people to come.
Well, NHS leaders say a staffing crisis is central to the pressure on the health service, a message they passed on to the Health Secretary, Steve Barclay, in talks this morning. We'll be hearing more about that in a moment. But first, the government in Wales has also been meeting health unions in a bid to avert strikes by nurses and ambulance workers. Its offer of a one-off payment hasn't gone down well. Let's get more from our Home Affairs correspondent, Andy Davies. Andy.
The fact that this meeting happened today, some may see as progress, but if anyone had been hoping that it could yield a seismic moment in terms of resolving the strikes issue in Wales, well, it didn't get anywhere near that. It comes after another strike yesterday by ambulance workers in Wales, with more to come involving midwives and physiotherapists. And what the Welsh Government has been offering here is an overall sum of money to be used as a one-off payment. None of those involved in today's talks would disclose how much money was on the table, and it's not clear how it might be divided up. I spoke earlier to Jess Turner from Unison. She was in the meeting.
They pitched this as that they want to do something for health workers, but that the money just simply isn't there. So they said they've looked at budgets and where there have been underspends and areas where they can potentially claw back some money, and they've put together a package that they say is basically all that they can afford. The important thing...
How much is that?
I can't tell you at this stage because we're very much still in negotiations. So in the spirit of those negotiations, I'm not going to share the figure. But what I can tell you is that the amount is unconsolidated.
In other words, it's not permanent, it's a one-off. And as welcome as these talks are, she went on to say, that creates a problem because it is not what the unions have been calling for, which is a much improved year-on-year pay rise, which the Welsh Government in turn claims that it can't offer without further funding from Westminster to Wales.
Well, so Andy, what are the next steps then?
Well, the unions say they will get together to discuss this, but that could be pretty brief because some of the unions involved today, certainly those who've been on strike, have given this very short shrift indeed. Have a listen now to Helen Wiley from the Royal College of Nursing, who came out and afterwards said that the Welsh Government had not been negotiating seriously on NHS pay.
This conversation today, whilst it's welcomed to be round the table talking, it falls very far short of any resolution of our dispute. So unless the Welsh Government can change that approach urgently, we will be in a position where we will be considering potentially further strike action, and we will make an announcement about that imminently.
Well, the Welsh Health Minister later said that she hoped these discussions can continue, and from the soundings we got, well, it's likely they will continue, but it's also very likely at this stage that they will do so against a backdrop of continuing industrial action.
Andy, thanks very much. Well, earlier I spoke to Professor Philip Banfield, who chairs the British Medical Association's UK Council and was at the talks with the Health Secretary today. I began by asking whether in his long career in medicine he's known anything like the pressures we're seeing in the NHS today.
Well, I've been in medicine for over 35 years and it's never been this bad. We've talked about winter pressures every year, saying that they're getting worse. We're seeing winter pressures into summer, and we're seeing the pandemic being blamed for the current state, but really it is year upon year of underinvestment. The public's experience at the moment is of an NHS that is either near to or has actually collapsed in places.
Has it actually collapsed already past tense?
Well, it has. We're seeing doctors and nurses with burnout, the moral injury from not being able to treat patients. We're seeing patients saying, please don't send me to hospital because I don't want to be on a trolley for 24 hours.
But you're going to make that situation worse if junior doctors go on strike, aren't you?
Well, I mean, junior doctors feel that they've got no option but to take industrial action because the government, frankly, isn't listening to their plight.
You had talks with the Health Secretary today. Have you got any hope that you can avert this strike?
The initial meeting with the Secretary of State today was positive. He listened. We were able to set out our stall. We were able to say that really there is no solving the problem with junior doctors unless the government considers full pay restoration and reform of the Doctors and Dentists Review Body.
You've talked about years of underinvestment by the government and, we ask ministers all the time about that. But would you accept that members of your union also have some responsibility to participate in reform of the NHS?
Yes, I don't think anyone thinks that the NHS can continue as it is. But if you're going to have redesign of a health service or meet the expectations of a public, if you're going to go from health service A to health service B, then there is a transition both in terms of the service model and also the funding.
But, the IFS did a report saying that there'd be more funding, more staff, but the NHS was treating fewer patients. And when Wes Streeting, the Shadow Health Secretary, took you to task on some of these things, he says he was treated as some sort of heretic by the BMA.
Well, I think I've met with Wes Streeting this week, so we have ironed out some of the comments that he's made. So, for instance, in general practice, the GP workload has just become crazy.
Yeah, but one of the objections he had was that GPs in England voted last month to cut surgery's core opening hours back to 9 till 5, which he made the point wasn't really sustainable in this day and age.
Well, at the moment, GPs are working hugely long hours and it's become unsustainable and they're burning out and giving up.
Have we now got a two-tier system? You talked about the NHS potentially having already collapsed. Is it now a situation that if you've got money, you pay to go private, and if you haven't, you're enduring terrible waits and potentially, you're threatening your own life or your family's life?
I mean, what a terrible state for our NHS to be in, that becomes the reality. And we certainly
that is the reality.
We do see a two-tier system in some places.
Have you or your family had private treatment to get stuff done because you can't get it on the NHS?
We have had to use private scans at times because the urgency and the essential nature of it was something that we didn't really want to bother the NHS with. I don't think that the private sector should be relied upon. It's usually much less effective and efficient. And of course, what the private sector can do is it can choose which patients to treat, which the NHS can't.
Professor Philip Banfield, thanks very much.
Thank you.